Hello everyone, I'm Dr. Alonso from Spain. I'm an anesthesiologist and I'm the director of a non-invasive ventilation group here in Valencia. I'm going to show you how to use the Boussignac CPAP in patients with hypoxemia or with pneumonia related to virus infection. I'm going to try to show you how to decrease the possibility of airborne widespreads during the CPAP therapy and also during the high flow therapy. First of all, some warnings that I have to say to you. You have to be aware about the use of non-invasive ventilation in patients with severe hypoxemia. For example, you have to have available endotracheal intubation immediately if the patient goes down, and also you have to be ready for invasive ventilation just in case there were no improvement of the clinical situation of our patients. For that reason, in patients with severe hypoxemia related to pneumonitis or pneumonia related to virus infection, it's really important to have a huge experience in the treatment of this kind of patients. I'm going to show you the different filters that are available for non-invasive ventilation and CPAP therapy in order to decrease the airborne dispersion of virus and other potential microorganisms related to viral or bacterial infections in patients with pneumonia or pneumonitis. Here you are, the different filters. We have 5 filters. It's important to remark that these are not heat and moisture exchangers, are only filters, so they are not going to add any humidification to the circuit. The main characteristic of these filters are that these filters have low resistance and have a low dead space. This is really important because they do not interfere with the system, with the CPAP, and also the low resistance range is between 0.5 to 0.9 centimeters of water, and the dead space that can add to the circuits is very low, less than 70-60 milliliters. First of all, I'm going to show you how to assemble the filters in the Boussignac CPAP system. The first step is to choose the face mask. We can choose whichever. This face mask is a very comfortable face mask for the Boussignac valve, or either we can use this one that is available in some European countries. The first step is to fit the elbow. We are going to put here the elbow. It's an ergonomic elbow. Secondly, we have to choose between the different filters. As you can see, all the filters fit perfectly. We have this one, another one. These two are intersurgical filters. We can choose this one. This is a Philips Respironic filter. The Fisher and Paykel filter, and finally the Medtronic filter. As you can see, all the filters fit perfectly with the elbow. After fitting the filter, we need to connect the FiO2 ring like this, okay? And finally, we need to connect the Boussignac valve with the noise reductor to reduce the noise and to decrease the turbulent flow. After showing how to assemble the filter to a CPAP system to make the system safer in the case of treatment of patients with respiratory infections, I'm going to show you how to interconnect a TEPs for nebulizing therapy. This is very important because sometimes patients need this type of therapy, and it's really important to decrease the spread of infection particles. First of all, we need to disconnect the elbow here. So you have the filter and the Boussignac system. After that, you have to connect the T-piece directly to the face mask, like this. And finally, you have to connect, again, the filter and the systems. This is really important because sometimes the particles can saturate the filter. And sometimes when you finish the therapy, you need to change the filter. It's really important to notice that some of the particles can escape through the leakage around the face mask. So this is not a 100% safe system, right? For that reason, all the practitioners, all the doctors, all the patient involved in the care of this patient should wear a proper mask, proper dress for the therapy. So this is the system assembled in a simulated lamp. So we have a mannequin here, and here we have the mask, the filter, and the Boussignac valve. Also, it's important to connect the manometer for pressure monitoring. I'm going to show you one important figure, that is when I increase the flow, up to almost 15, you can see the line here. So there is a perfect transmission of the pressure from the Boussignac valve through the filter directly to the lungs. So here we are, the land model. I'm going to show you how to perform the Boussignac CPAP in a spontaneous model of simulation. I'm going to start button here, and you can see the patient is breathing, and I'm going to start the CPAP therapy. So the only thing you have to do is to increase the flow. The more the flow, the more the pressure you get. So take a look at the manometer here, and this is perfectly 10, and you can watch here the oscillation of the pressure. So this demonstrates that the filter is not interfering in the systems. And finally, to finish this video, I'm going to show you how to interconnect the T-piece for nebulizing therapy in a lung model. First of all, we need to start with the CPAP. So we have to increase progressively the flow until the pressure desired. For example, 25 liters per minute to achieve a pressure of 8. Secondly, we have to connect here the system to the oxygen of the nebulizer and increase the flow up to approximately 6 liters. Okay, and I'm going to start the simulator. As you can see, there is no spread, or there is a decrease of the spread of the particles, and the system is almost closed. There is a unidirectional flow to the patient, so it's like you are trying to project the particles, the particles of the therapy into the lungs.